Hello everyone, grateful to participate in the 22nd World Congress of Gerontology and Geriatrics. Intervention and cognitive rehabilitation in older adults with arterial hypertension and mild cognitive impairment. The increasing prevalence of mild cognitive impairment comorbid with arterial hypertension needs to be studied in its interaction with the available interventions. To compare the effect on cognitive functions of cognitive rehabilitation with that of other forms of stimulation in control interventions. The design was quasi-experimental, descriptive, comparative, longitudinal. The IVs included are participation in CR sessions and 4 other forms of cognitive stimuli not manipulated in the study: performing physical exercise, gymnastic or walks, hobbies or creative activities, home mental activities like crossword puzzles, sudokus or alphabet soups, among others, and work activity. The sample had 129 participants selected by convenience sampling referred by neurologists from the metropolitan region of Argentina to a private psychopedagogy clinic specialized in neurodiagnosis for evaluation due to suspected cognitive impairment.
The inclusion-exclusion criteria were age over 54 years, diagnosis of hypertension with a deterioration in at least 2 areas of cognitive performance and with vascular deterioration, dependent variable according to the NINS area criteria.
The Addenbrooke's Cognitive Examination Brief Dementia Screening Battery has a validation study in Argentina in populations with high and low education. The test token is aimed at evaluating receptive comprehensive language for long sentences through responses to orders of increasing complexity. Frontal screening is a brief tool to assess executive functions. It is a sensitive and specific tool for the detection of executive dysfunctions associated with neurodegenerative diseases. Trail making test is one of the most used tests to evaluate attentional processes. Patients could opt for weekly individual sessions, platform use, extra session weekly exercise book. The individual sessions involve weekly attendance to carry out written exercise in the office or on computer with therapeutic support like Zoom, Meet, WhatsApp video, with immediate assessment of an action plan. This plan indicated the functions that would be reinforced through specific programs, since it was intended to multi-stimulate different brain areas. Due to the aforementioned, a status assessment was made in each session.
Numbers in red identify categories or means showing significant differences for proportions test or t-test. In addition, younger age and higher levels of schooling are predictors of a better initial level in almost all dependent variables. In contrast, the greatest gains were recorded in specifically linguistic functions among those with a higher level of ischemia and, above all, among those who had a shorter academic career. This successive analysis suggested the inclusion of years of formal education and of covariates of the ANCOVA. The results obtained by ANCOVA for differences in gains in RV associated with each form of stimulation independently of the others and controlling for age indicate that the form of stimulation that produces gains in greater quality is CR sessions. To illustrate these concepts, we can consider the representations of the evolutions from these levels of a vascular impairment, in this case ACE memory, although there is no significant difference between the two scores. Figure 1 shows a tendency towards minimal earnings among those who work, but it seems higher among those who do not work. In Figure 1, we observe ACE memory scores pre- and post-intervention according to performance of work activity. In Figure 2, in the pre- and post-intervention ACE memory scores according to cognitive rehabilitation sessions. To conclude, the efficacy of an intervention to stimulate higher brain functions in patients with proven cognitive impairment have been demonstrated. The intervention is carried out in a systematic, progressive, and varied manner. With the specific objectives, we can conclude that these places are viable responses in pandemic and post-pandemic contexts.